Welcome, everyone. My name is Amber Strickler. I am a life counselor with Roanoke County Public Schools. I'm currently based in an elementary setting. So I'm going to be the one today that's providing you all with mental health information, trying to specifically gear that more towards parents that have children in an elementary setting. Um, it is a wonderful resource that Roanoke County Public Schools offers this to our parents. We're going to talk about today what is mental health, signs and symptoms that you guys can look for, how to access resources, and when you should probably reach out for help or when your students should reach out to help. This presentation is also provided to staff members in the schools, teachers, IAs, admin. They also get the same training, and we do provide mental health presentation to students as well. On the elementary level, it is more geared towards stress management, overall wellness, making good decisions, things like that. Fifth grade and kind of beyond that into the secondary schools, they focus a little bit more specific on mental health topics. But the younger grades get more just like a wellness based. So today, we'll be discussing a lot of different variables around mental health. I'm going to try to keep this, I'm going to try to be mindful of your time first and foremost. But at the end of the presentation, if you guys do have any additional questions, I'm going to give you some information about who you can reach out to and ask any of your questions to if you need assistance from. So please let us know if we can help in any way. All right, let's jump into it. So, what is mental health? So, mental health in general, everybody has mental health well being. So, mental health covers a lot of different aspects in our lives. That is our physical health, our psychological our social wealth, like our functioning with other people, and our emotional wealth. So, a lot of different areas can encompass our mental health. Mental health is really important for everyone because it can really affect our day to day functioning. It affects how we socialize and interact with other people, how we make decisions in our lives, how we handle stress. So, really important for us to be aware of and also know when to access help and get help. So, mental health disorders are when our functioning becomes impaired. So, we might notice changes in our thinking. Maybe we're more negative about situations, and maybe we're not as hopeful as we were about our lives or a situation. We might notice uncharacteristic changes in our mood. So, we could become really sad, really nervous, really stressed, any kind of major changes in our mood, and then any major changes that can happen with our behavior. Um, we're going to talk about some more examples later, but that's just kind of a brief overview. So, a mental disorder is when our functioning and our decision making and our thought processes start to become impaired. So, why should we care about mental health? Well, first and foremost, we just said mental health applies to everyone. We hope that most people's mental health is doing well, but regardless, it applies to all of us. Our mental health is just as important to our physical health, and there is a strong connection between the two of them. So, just a very simple kind of explanation or example is for stress. So, stress, chronic stress over long periods of time, if it's not managed or not taken care of, that does increase your risk for physical health conditions to include like heart disease or even like blood pressure, high blood pressure issues. So, not managing our mental health as much as we should or we need to can lead to physical health issues as well. And in turn, our physical health issues can create issues with our mental health as well. So they do go very hand in hand. Some information as to why we want to provide this information to our parents and our staff and our students is to one, we want to decrease that stigma. There is a large stigma around mental health. We do hope in the mental health field that is decreasing over time. But as of right now, kind of where it stands, once somebody identifies that they have a mental health need, the average wait before they really access treatment and get help is about 11 years. So if we're looking at that on an elementary level, if our students realize now in elementary school that they are having some form of a mental health struggle, we are looking at high school or even early adulthood until they really access the treatment they need. And that's pretty alarming. That's a long period of time and a lot of development that happens over that time where we could be helping and really kind of getting interventions and skills in play. And then 20% of youth struggle with mental health. So we're talking about 1 in 5 students are struggling with mental health. Um, so really want to help address that as much as we can. I tell students in my elementary presentation, you know, in a class of 20, we're looking at 5 of those students are struggling with mental health. And we're going to talk about later how somebody struggling with mental health is going to disrupt their academics as well as other people. And additionally, youth suicide rates have increased nationally over the last decade, and that's specifically between ages of 15 and 24. And in the state of Virginia, suicide is the second leading cause of death between 10 and 24-year-olds. 10-year-olds are falling into our population. That is falling into our elementary school population. And typically, with suicide or suicidal ideations, those things don't typically develop overnight. So things are kind of ramping up to get to that point, which indicates to us there are younger elementary school ages that are struggling with mental health and need intervention sooner than age 10. So, speaking of suicide, just some statistics surrounding suicide rates. So, students, or well, specifically youth of LGBTQ, are 5 times more likely to have attempted suicide compared to youth that identify as heterosexual. Youth of color, they have a 2 times higher rate than Caucasian children ages 5 to 12, 5 to 12, right in our age range. And then youth requiring hospitalization. So the hospitalization rates for those either contemplating or attempting suicide has doubled in less than a decade. Hospitalizations and being able to access a bed, that is becoming a nationwide issue. And that's not just on the adult level, it also is occurring on the youth level. So we definitely want to try to intervene as much as we can. We want to avoid hospitalization, regardless at all cost, but especially, with bed availability being pretty limited. So, Christine Boston is an assistant superintendent of a school that had experienced some student suicides at their school. And in her interview, she was talking about, how we need to intervene early. And in that, she said, take it seriously when a student talks about wanting to die, feeling hopeless, not having a purpose, or being a burden. Um, that is something, once you notice those things, that's a sign that, hey, we need to get some help. Let's get in there, let's talk to the kid and try to help them so that we can avoid suicide or even contemplation of that at all cost. We want to do as much as we can to try to prevent that. So, for parents, and also some things that we look for on as clinical providers, and we've also trained our staff to look for, is some big warning signs. Um, First and foremost, if you notice any type of uncharacteristic kind of major change with your student and that throws up a red flag and you're concerned about that, we want to make sure that we're addressing that. Check in with your student, kind of see what's happening, what's going on. You can reach out to the school's resources to see if things are changing as well, like within the classroom or socialization at school, and seeing how the resources at school could also be of help to your student. So some things that you guys can look for is if you notice your student is seeming very sad a lot of the time. They are isolating themselves out of a situation, aren't being as interactive. Maybe they isolate off to their bedroom a lot, or even a conversation, they seem very withdrawn. If that seems to be happening of 2 weeks or more, we want to make sure that we check in. Um, of course, any statements, any actions or plans of trying to harm themselves and their own lives, any disturbing like images or writings of like darker themes, we want to make note of that as well. Um, and any type of severe, out of control kind of risk taking behavior. So, sneaking out, like running off into traffic, anything of alarm like that. Um, Excessive drug and alcohol use. We don't typically see drug and alcohol use as much on the elementary ages, but it is important to note that a lot of students have older siblings that may be experimenting or becoming more exposed because of their social environments to drugs or alcohol. There could be family members that might be using things like that. So again, we don't typically see that as so much on the elementary level, but definitely some things that we want to look out for, want to be really mindful of the exposure that they could be having. Um, any changes in their mood, like we initially discussed, any changes, major changes in their mood, changes in their eating habits. We're going to talk about that a little bit more in a minute, as well as changes in their sleep habits, which we're going to discuss more. Changes in their physical appearance, their grooming, their hygiene. So, if you notice maybe they're going a few days without showering or not brushing their hair, or maybe they're a student who typically really enjoys and puts a lot of pride in what they wear and their outfits and getting ready, making things match or making it unique, whatever that might be. And you notice that kind of declines or changes, that would be definitely a warning sign, kind of a red flag. So any kind of major change of that nature. So this poster, I love this poster. It's a lot in one poster, but NAMI is the National Alliance of Mental Illness. And NAMI is a wonderful, wonderful resource. So if you have more questions about mental health in general, NAMI covers a lot of different topics. I believe, even on their website, I think they still have it. They had like support group access, so you could find local mental health support groups. I helped somebody try to find one a couple months ago, and it was still working then. But overall, they have a lot of just like mental health information and resources that you can access. So always try to recommend NAMI if somebody wants more information. So on this presentation, kind of gives you some outlines. So, worried about yourself or somebody else you care about, make note of the signs and the symptoms, and make a connection with the person that you're talking to. So, try to understand from their point of view what's going on. Don't judge them, just get some input from their side. Making that connection and knowing that student, knowing they have somebody to go to and have that support from, is going to make the world of difference. So knowledge is power. So one, providing the mental health presentation day, us giving you as much information as we can. You can also talk to healthcare professionals, school resources when it comes to this stuff. I talked about NAMI. I'm going to give you some more resources at the end of the presentation. There's mental health classes, there's support groups. There's a lot of different avenues to access more information if you want it. So 50% of lifetime mental illness begins by the age of 14. So that's a pretty young age. And then by 24, we're looking at 75%. So the earlier we can target these things, the earlier we can help students recognize signs, help them learn just healthy coping skills to avoid these things escalating and becoming a disorder, the better off we're going to be. All right. So today we'll talk about a couple of mental health disorders that can occur, anxiety being one of them. We do see anxiety quite frequently, especially in the school population. There obviously is a lot of stress around academics and socialization and things of that nature. So, anxiety is when a student or an individual has a hard time controlling that worry. So, they don't have the right skills or ability to handle the nervousness or anxiety that they're experiencing with the situation. Typically, that anxiety is at least 6 months, if not longer. Can usually expand much, much longer than that. And the anxiety can occur about one specific topic, or it can be a multitude of topics and activities and experiences. Can be just day to day life stuff. So it doesn't necessarily have to be one specific thing. So, worry can, like we talked about earlier, mental health and our physical health can go hand in hand. So our worry can cause physical symptoms. I'm going to give you some examples in a minute. So the physical symptoms plus the worry can impair our functioning, our socialization, our day to day activities, our decision making. So that's when we start looking at an anxiety disorder. So the thing that we want to note with any kind of mental health, anxiety, depression that we're going to talk about in a little bit, disorders and the symptoms of those disorders are not being caused by another condition. They're not being caused by a medication. These things are organic and are happening because they don't have the ability to control the worry. It's not being induced by something else. So that's something important to know. So, anxiety in children. So, I want to make it very clear that some children can have different variations of these symptoms. A lot of the times on an elementary level, we are going to see a lot more of the physical symptoms because they don't have the verbiage and the executive functioning and processing to detail it like we would as an adult. So it's going to manifest more in a physical manner than in a verbal one. So, anxiety with children, some emotional symptoms that you might see is they have dread about a situation. I don't want to go. I don't know why. I need to do this. I'm nervous about going to this, feeling tense and jumpy. So they seem very on edge. They could also be very restless. They're moving around a lot. They're fidgeting a lot. Maybe they're tapping a lot. They're moving their legs a lot. Any kind of like uncomfortable kind of movement. I do see with a lot of children, like pulling at their hands or their fingers. That does seem to happen quite a bit. Um, and even with the restlessness, they can have difficulty concentrating. So, maybe that's a school assignment, an enjoyable task, any area of their life can't focus. They're always thinking about worst case scenarios, even if it seems very irrational and unlikely to happen. They could be really fatigued. So the mental drain of anxiety and all of the stress from that can be very wearing on the body. So they could be really tired. They could be frequently crying, angry, yelling, defiant. They could potentially even be aggressive. And so those are signs that we might see. They could have an unhealthy fixation on achievement or even perfectionism. So holding themselves to a standard that's not even really achievable. Physical symptoms that they may state to you as a parent is, hey, my stomach is hurting really bad. I'm having a stomach ache. Hey, my chest is pounding, or my chest feels really tight. It feels like it's racing, and I'm having a hard time breathing. Or they could even say, like, I'm having a really bad headache. I'm really, really tired. And even being really, really tired, they may not be able to go to sleep. Feels like their mind is kind of never shutting off. So just some kind of overview symptoms. And this is not an all-inclusive list. These are just some examples because we're all human, we're very individualized. So this stuff can display very differently. In my presentation with the elementary students, I try to get them to identify kind of where in their body they feel the anxiety, whether it's like their chest tightness or their headache. So they become familiar with what symptoms occur when they're feeling that way and can be able to link the two together. Right. So it is important to notice anxiety occurs in everyone from time to time. So where we need to become concerned, like we talked about earlier, is when we're getting to the level of a disorder. And again, a level to a disorder is when it begins to impair our functioning and our ability to do day to day life. All right, so depression is another one we can see with children. So, depression can come off as being sad or hopeless. They could even be irritable, just not enjoying things that they would typically enjoy. So, one of the questions I really like to ask kids when I'm trying to get a feel for kind of a depression scaling is, hey, what are some things that you enjoy doing? And so they'll tell me, oh, I love coloring. And I'm like, well, do you still enjoy doing that? Is that something that, you still have interest in and have the energy to do? And if they're like, no, automatic red flag, because I know from what they're telling me that's not characteristic for them not to not enjoy that activity. So just very simple questions like that. And as a parent, you're going to know the likes of your student. So if you notice that your student isn't enjoying those hobbies like they typically would, maybe just kind of touch base with them. Maybe they're having a bad day, but maybe something else is kind of going on. So touch base with them, just kind of see. And so our eating habits and our sleep patterns can change as well when it comes to depression. There is no set thing for this. So some people can have variations in it. It can be pretty unpredictable. So they might like their eating habits, they might want to eat a whole lot more. And then the next day they just have no appetite, maybe for the next day or couple of days. Um, or between depression episodes, they might want to eat more. And then the next depression episode, a couple of weeks later, they might not want to eat at all. So it can really vary. But if you notice any major changes, that's not like them. And again, these symptoms that we're looking for are over 2 weeks or more. So if you see these kind of changes, be alerting of that. Um, so sleeping habits. So if they are usually really sound, good sleepers, and you notice that they just aren't really sleeping very well, they're having a hard time falling asleep or maybe even staying asleep or both, or you find that they want to sleep a whole lot more. So sometimes with depression, like anxiety, it can wear us out, it can drain us down. So all we want to do is sleep. Some people want to sleep to try to avoid the things that are depressing them or upsetting in their lives. Who you can see changes kind of going either way on that aspect. Changes in their energy, just like talking about with anxiety. So it can really wear us down, being really tired, sluggish, being tense. You might also see some of that restlessness, but just not having the energy to do things like they typically would. Concentration issues. A big one that we can see is feeling like worthless, useless, or guilty. So um, I don't know the point in why I'm even trying. You know, what's the point? I'm just going to fail it anyways. Just having like that very like negative kind of mindset. Nobody likes me. Everybody hates me. I don't mean anything to anybody. Things like that. Any kind of self injury, self destructive behavior. So cutting, punching themselves, um, uh, burning can be another one. With elementary students, I see a lot of hair pulling, or even, I don't know if you guys can see on the little screen, but even like digging their nails into the palm of their hand. So doing that, kind of getting that pain that way. Um, a lot of scratching. They can do a lot of scratching, or, and it doesn't have to just be the arm. It can be, neck, arms, legs, or even, um, I just brain blanked. Well, if it comes to me, guys, I'll let you know. But scratching is a big one, and then the hand one is a big one. Oh, that's what it was. Taking any type of like utensil or writing material or something around them and kind of digging it into their skin. That was the one I couldn't think of. All right. And again, not caused by other conditions or medications. All right. So, like we talked about earlier with the statistics, is mental health can have an effect on our academics. So, if we do have those 5 students that are struggling with mental health, that can, one, disrupt their academics, because we talked about if they don't have the energy to get up out of bed, they might miss school. They might not have the energy to do classwork. They could be irritable. They could just dread even doing the assignment, like we talked about with anxiety. So it can definitely have an effect on their academics. They can have a hard time sitting still in class. They could be acting out in class, disrupting the rest of the class. They could notice like a decline in their grades, because we also talked about it can affect our concentration. So if they're not concentrating on an assignment, that could lead to them missing details, just not answering questions, maybe not even finishing the assignment. It can also affect their like involvement. So if they have a group activity and they don't have the energy, or for whatever reason, for whichever symptom, whether they don't have the energy, they don't have the focus, they just want to isolate, whatever symptom that might be, in a group activity, if that attribute is needed, then that obviously is going to have an impact on their group involvement as well. If you're withdrawn and isolated and you have to answer questions in class, that's going to have an impact there. So it can impact a lot of different areas of their academics. And this can disrupt, obviously, the rest of the class as well. So if you're dependent on that group member to help you out and they can't do that, it's going to affect them as well. All right, some additional warning signs. If you notice like repetitive behaviors, like I have to lock the door 4 times before I can leave the house, or um, routine kind of like checking behind one another. So that can be checking the doorknob. That could also be looking at academics. That could be I'm doing a test and I have checked problem number 3 multiple times because I'm anxious that I didn't get it right. Um, so I'm going to keep checking that answer and it delays me turning it in, or maybe it delays me to going to question number 4 and I don't get some of it done. Excessive hand washing. Obviously, we understand right now we're in the times of pandemic, but excessive hand washing, that's kind of leading to a very significant irrational anxiety as well. And also expressing just like indifference about something. Who cares? Why try? Expressing disturbing thoughts and images, feelings through art and writings. So we talked about this one earlier. If you see an essay or a story or some sort of imagery that your child is creating, and it does have some of those darker kind of themes, just check in with them. Make sure nothing's kind of going on with that, especially if there's anything with like harming, violence, death. That could be another indicator as well. We talked about changes in mood, concentration, isolating, and having negative outlooks, self harm. And we talked about reckless, destructive behaviors, as well as school refusals and truancy. So if you notice they are just really defiant and coming to school for whatever the statement is, I can't get out of bed or I don't want to go, try to dig a little bit deeper, kind of see what's going on there. That's kind of the root cause of that. So, our schools and our communities, we do have resources to be able to help with mental health. Again, we do want to try to catch these things as early as we can, which is why we're implementing a lot of this on the elementary level as well. And we do have resources in the elementary schools as well as the secondary schools to try to help with this stuff. So, if you see or hear of any of these things that we've talked about today, please seek help for your student. If you're not sure and you need advice, talk to a healthcare professional, whether that's in the community or even at the schools. All right. So trauma is one of our big ones. Trauma can very significantly impact our mental health, very significantly. Now, I want to be very mindful to say that there are people who have been very resilient and have bounced back from their trauma. That can happen. What we are talking about today is when trauma is still affecting them and it's affecting their functioning. We want to make sure we're getting them help. We want to be able to help them bounce back and become resilient to what's happened. So I love this image. I think it's amazing. So if we're looking at this image on our left side, we have a brain without trauma. So this is a brain that is, functioning, is doing day-to-day tasks okay, has not experienced any kind of trauma in their life. On our right side, we have a brain that has experienced trauma. So when somebody has experienced trauma, it restructures our brain. It will restructure how things are processed, how things are organized. It is going to restructure our brain. Trauma is when we have an experience that overwhelms our ability to cope with it or with life in general afterwards. So trauma has affected our ability to cope. Okay, that can be one experience, that can be multiple experiences that have happened. Chronic stress over time can be trauma for some people because it can overwhelm their ability to cope. It can cause them to feel kind of helpless and hopeless and can make them very scared. So, this brain on our right has had the trauma. You can see that there are visual differences between each of these brains. So, the brain that has trauma is going to be more survival based. They are going to want to protect themselves and look out for themselves and want to make sure that they're safe. So, this brain on the right doesn't have very good ability to cope, and they are in survival mode, essentially, is the easiest way to explain it. So the reason I love this image is because it shows very clearly that there are going to be differences in the brain when we're talking about trauma. Now, this brain on the right has full ability with the right resources to, find some ways to cope and kind of help with their day to day life functioning. So that's what we want to try to help do as much as we can. We don't want somebody to look at these images and think that they're defeated. They're not. This is why we're here. We want to be able to help. Okay, so trauma. So trauma is in the eyes of the person who's experienced it. So you can have two people side by side that have had they were in the exact same situation. Their experiences can be totally different. One person could have that situation happen, and in their experience, it has now become overwhelming to the point that they can't cope. This other person, that may not be the case. They had this experience, but they are still able to cope. So two people can be in the exact same situation, and one could still end up with trauma and the other person couldn't. So trauma is in the eyes of the person whose experienced it is in the eyes of the beholder. So trauma, this is just an example list. This is not an all-inclusive list because again, trauma is very subjective. So it could be a death in the family. It could be abuse or neglect. It could be financial difficulties. It could be natural disasters. Over here on my right is my natural disaster examples. It could be just chronic long-term stress that you've gone through in your life. Relocating can be traumatic for some people. For some students, like relocating a lot of times can be kind of traumatic for them. Having conflict in their lives, peers, relationships with adults, having conflict just in the family that they witness or overhear a lot, or even divorce and separation in the family. So, and separation could even be a grandparent or somebody who was living in the home and was very close to them and very involved in day to day life and has now moved out of the home. So, separation in that aspect too. Again, not an all inclusive list, just some examples. So, again, we talked about trauma affecting the brain. So, when the brain experiences a trauma or toxic stress, it changes the way we are able to handle everyday situations. We can have strong emotions, we can have lack of focus and memory, and we can have conflicts with our friends and our family. So, again, trauma is affecting our brain. It can affect how we are coping, it can affect our day to day functioning, and it can affect our socialization as well. So, with trauma, everybody is going to have one of three responses. So, when you have a very alarming or traumatic situation, you are either going to be a fight, flight, or freeze. So, the easiest way for me to explain this to somebody who may have not had trauma is when something startling or alerting happens, you are normally going to have one of these three responses. So, that's going to kind of be your go to thing. With flight, it's escaping and getting out of the situation. Fight is when you start kind of lashing back. That could be physically, that can be verbally. And freeze, you kind of shut down and kind of withdraw kind of into yourself. Feel like you can't move. You can almost feel like you're just stuck verbally and physically. You're just stuck. So your body it feels like your whole body just kind of shuts down. So the flight, fight, or freeze, one of the three. And then when we see somebody who has had that right side picture trauma brain, when we talked about them being in survival mode. So they are constantly on edge to make sure that they are protected. So when somebody can come at them and not even it may not even be something of an aggressive nature or an intensive nature, but their mind may perceive it that way. So when somebody comes at them, they they could very quickly react in one of these three manners. So that's why if you come up to a student who's had trauma, they might start arguing with you or getting very defensive, um, because their reaction, their mechanism is for fighting. Or you might have the student who, when you come up to them, they kind of curl up into the hallway and ball up. They don't talk, they don't speak, they don't make eye contact, they just kind of freeze within themselves. They're a freeze response. Flight, they're trying to get out of the situation, deflecting, getting out of it. I don't want to be here. Let me get out of here. They start walking away from you. That would be more of our flight side. So just to be mindful when you are approaching somebody or a student with trauma, or if your student or if your child has experienced trauma and you come up to them and you get kind of this one of these reactions, it could be kind of triggering out of that. Not intentional. They're not trying to be hateful or mean if they come from the fight response. They're not trying to be avoidant if they're in the flight or freeze. It's just their body's response to the situation. All right. So, what can you do to help? So, predictability, consistency, predictability, consistency, predictability, consistency. Children can thrive off of that. They also need to know that their space is safe. So, we need to make sure that we are giving them a safe and predictable home environment. They know what to expect. Um, and these things are consistent. So, if there's multiple children, these things are consistent with multiple children, as much as you can be. So, having that predictability, is a huge thing. Having that consistency, and knowing that they're safe. Practice and reinforce. So reinforce and teaching ways how they can handle stress, different coping skills for when they're upset, and how they can ask for help. So, hey, when you're having big feelings like this, okay, and identify whatever that feeling is. When you're having a big feeling like this, you can come to me or dad. You can come to us. You can come to grandpa if you're having a big feeling like this. So knowing who they can go to. Hey, when we have big feelings like this, you say coloring always calms you down and can kind of help you out. Let's try that. Let's see if that works. So reinforcing that skill. Um, and so also encourage them. So have good communication. So I think having, just like we talked about, hey, talking with them when you have this big feeling, who can you go to? This is a coping skill that's worked for you before. That's good communication. Hey, I'm here to support you. I want to help you. When you're ready to talk, I want to be here. I want to listen. I'm a safe space for you. So I just want you to know I'm not going to judge you. I want to understand what's going on. So just having good communication with them, promoting good decision making, letting them know we want to counteract this stigma. Hey, there's nothing wrong with needing help. We all need help sometimes. So we're all human. We have things that happen in our lives. I love telling students when I work with them, I'm human too, right? I have days that are stressful, but I've got to use my coping skills and the things that I know to help me to make me feel better. So, what we want to help you do is find the coping skills that work for you. So we know that you have things to go to. So we can keep the stress from getting worse, or we can keep your sadness from getting worse, things like that. And using stress reduction strategies. So just like we talked about, hey, you love coloring. Let's color. Let's do it together. Let's color together. Or hey, you want to go for a walk? It's really nice outside. Let's go take a walk. So things like that. Bilateral movement. So walking and moving. Love dancing. Any kind of like physical body movement that can be really good for people in general, but definitely for kiddos because they love that. They love the activity level, but really good for calming them down. All right. So, even more ways you can help. Again, communicate with your student. Try to get information from them. Don't come at it with a judgmental stance. We're just trying to figure out what's going on. You are information seekers. You are just taking it in. Okay. You're taking it in and you're going to be there as a support. You can refer students to school resources. So that can include the school counselors. You're going to have school counselors at your student's school. If your school has a life counselor, you can refer them to the life counselors as well. So the life counselor is not the same thing as the school counselor. Your life counselor is a Virginia licensed mental health therapist that's in your schools. Um, so they're doing their role is going to look a little bit differently than the school counselors, but school counselors and life counselors are both clinical and can help with needs. We have school social workers, the school psychologist, admin, and even your child study IEP teams can provide information and are very aware of resources that are available as well. You can also contact community and healthcare providers. I know a lot of parents that seek kind of the first role through pediatricians to kind of get an idea. Again, I'm going to give you some resources here in just a little bit. If you don't really know where to start, reach out to the school and we'll see how we can help. Um, and again, you're not alone. Support is available. So please let us know how we can help you. Reach out to somebody so we can help. We don't expect you to have all the answers. We want to be able to guide you and help you as much as we can. All right, so promoting resiliency with protective factors. So things that are really going to help students bounce back are going to be having good supportive relationships in their lives, peers, family, having help, support, love, consistency, safeness from those people, having an interest in school, but also being successful at it. Children, students, the majority of their lives right now are surrounded by school helping them get to whatever future they want to do. So there's a lot wrapped up in school for them. So having them interested and successful in it is going to be a really big deal for them, helping them feel like they have like a purpose and they're doing really well in one of the biggest things in their lives. Having a sense of being loved. And again, this says by parents, but grandparents, friends, family in general. Having healthy encouragement with adults outside of the home, having good self esteem, viewing themselves in a positive way. You are really smart. You do amazing. That A, that is phenomenal. I'm really proud of you, right? And so giving them these positive feedbacks and hope that that is going to instill something in them and have those same kind of values for themselves. Like, wow, they just told me I was phenomenal. Maybe I did do a really good job. I'm proud of myself for studying for that. So having having just positive words of encouragement, um, boosting their self-esteem and them creating a positive self-esteem for themselves, finding different attributes about themselves that, they can be really proud in. Um, Open communication, we've talked about that. So giving them the space to articulate their feelings. Again, on an elementary level, they are really young. And it can be very hard for them to try to articulate what's happening in that brain of theirs. So let them talk it out. Let them try to figure it out. Let them try to find the words. If they want to, you don't have to push that, but if they want to, let them try to find the words. Drawing is another way to kind of get out. Let them draw. Hey, draw what you're feeling right now. Let them draw it out. Hey, can you explain this to me? Kind of let me know what's happening here in this photo as much as they can. Um, any type of arts and crafts. Play-Doh's another good one. So kind of getting they're more hands-on feels great with elementary ages. And good coping skills and having good role models of people who are functioning well and using their coping skills when things aren't going well. All right. So, elementary level, how are we teaching students? So, at the elementary schools, your student is getting a mental health presentation by either the school counselor or the life counselor. And as we talked about earlier on the elementary level, from K through 4, we're talking about more wellness and stress. Fifth grade gets a very general conversation about mental health. Just kind of like we do talk about like stress as well, but just kind of getting like precursors to or kind of a heads up of this is what anxiety looks like. This is what depression can look like. If you are having these things, ask for help, get an adult, things like that. And we do deliver this information by class presentation. So on the next couple of slides, I'm going to give you an example of the student mental health presentation. Kind of looks, um, well, it does. It looks exactly like the slide that I present to the students at my schools. So let me show you this. So again, we talk about stress management, wellness. So one of the example slides is, what is stress? So stress can be a feeling or an emotion. I love to get them to identify other feelings and emotions, so we're kind of on the same page with what is a feeling. And stress can feel like we're overwhelmed. We have a lot of stuff to do and not enough time to do it. Uh, So this is what I was referencing to you all earlier. So being able to identify stress within our body. So especially in elementary age, we do see a lot more of this in a physical manner. So the headaches, the changes in our sleep and our appetite, the body aches, things of that nature. So this is kind of the, hey, how do we feel stress in our body? Right. And what I love to get the kids to do is we talk about these different areas, and them try to identify at least one area in their body where they can, when they experience stress, where do they feel it in their body? So the hope is once they realize, they may not initially realize, like, hey, I'm stressed. They may realize, hey, my stomach is hurting. Okay. And I know when my stomach hurts, because we talked about that in the mental health presentation, I know when my stomach hurts, that could be a sign that I'm stressed. So let me think about, am I stressed right now? Kind of what's happening. So it's kind of one of the first jump starts that they can look at to make sure, they're not stressed, their mental health is okay. And oh yeah, I realize I'm stressed. Okay, my stomach hurts. I now realize I'm stressed. Let me do a coping skill really quick, right? Let me do this skill to kind of calm myself down really quick so I can get back on task with what I'm doing. So um, and the kids really love the elephant. That really, it cracks them up every time. Why do you have an elephant sitting on your chest? I get that one a lot. Okay. So, and then I explain to them, when I am stressed, my chest feels really tight and it feels like I have an elephant sitting on it. So I try to give that example for myself, as I know where my cue is. I want you guys to learn your cue. Okay, so who can help? So this is another thing we tell our students, who they can go to. So parents or guardians, absolutely. The school counselor, the any kind of grandparents, their teachers. We talk about admin, any staff in the school, a trusted adult. We make it very clear in the presentation it needs to be an adult. So they're on the slides when we're talking about, if you find yourself worrying a lot of the time, or you find yourself sad a lot of the time, you need to talk to an adult. Make sure you tell an adult. So we really hone in, it needs to be an adult. It's great if you want to get support from your friends, but an adult needs to know as well, because we're the ones equipped to help handle the problem. All right. So we talk about coping skills. So first, a good coping skill is go to an adult, get help. That can technically be a coping skill. Get the accessing your resources. So another skill is exercising. And the kids really get a crack up at the dog, doing, downward dog and all these different positions. So I really like that picture. But, exercising, getting outside, playing, being around other people. I did tell the kids, if you're really, really stressed, right? If you're really, really stressed at home trying to work on something, ask your parents if it's okay if you go outside, where they can see you. You can go outside for 2 to 3 minutes, calm yourself back down, run in circles, do jumping jacks, dance, do whatever you got to do, play for a minute, and bring yourself back to it. Give yourself a minute to kind of calm down if you get really stressed out. So, exercising, playing sports, anything like that. All right. So, resources for you as parents. Um, So, some of the resources in the schools we talked about is the school counselor. We have the life counselors. You have your school social workers, your school psychologists, your school nurses. We've had nurses bring students to us. Hey, they're talking about a stomach ache. Medically, physically, they are okay. And the student has now disclosed that there are some other things kind of going on. They've had a really bad day, a really stressful day. So they have now brought them to us. So nurses have been a resource for us as well in the schools, but they can also be a resource for you as parents. Your administrators are very involved. They're aware of what's happening with your students, so they're a resource as well. In the community, Blue Ridge Behavioral Healthcare, they do offer child, youth, and family services as well. So that telephone number is a telephone number to their child, youth, and family location if you want some more information on how to access that. Their website can also detail some of the services that they offer for youth as well. And again, kind of frontline healthcare workers, pediatrician, family doctor. And then there's the suicide prevention helpline. So if you're ever concerned about your child having suicidal ideations or thoughts or themes kind of related to that, whether it's in images or writings, that's a resource. All right. Online resources. I'm going to leave this up here for a second. So if anybody wants to take a picture of it or whatever. So online resources, we have Parents Preventing Teen Drug Use and Addiction. Obviously, that one doesn't apply to the elementary level so much, but they can age and become teens, so that's a resource. The next one, we'll talk about like signs and symptoms that can indicate that help is needed. So that can be a good resource. The CDC kind of overviewing anxiety and depression in children, the Roanoke Community Resources Group, the National Alliance on Mental Illness. So that's NAMI, like we were talking about earlier, and the National Child Traumatic Stress Network is another really good one for trauma resources. So that is all the information we have. I hope I was able to give you guys some good information, some good oversight about stuff. If you do have more questions, remember we are here to help you. We are here to give you some guidance. So reach out to healthcare providers, reach out to your schools, and ask for more information. So please let us help as we can. At the bottom is the website for the counseling of Roanoke County Public Schools. So thank you, and we appreciate your time, and please let us know if we can be of any help.